I'm Mike Blumberg, an LCPC, which is Licensed Clinical Professional Counselor. I have a master's degree in counseling, and I have been practicing for over 10 years here in the Glenview area, for about 5 at a place called Glenview Counseling Group. So I have a specialization in treating OCD and complex anxiety disorders. I've been doing that for quite some time, and the way that I came into that was through my own experience with OCD. I had been an OCD sufferer for a long time and have been in recovery using the very same evidence-based techniques that I now help other people with. And so that obviously gave me a pretty big interest in doing that kind of work. Beyond OCD, I work a lot with people with specific phobias. For example, flying phobias, fear of vomit is relatively common. It's something that I see a lot of. And there are also a lot of more complicated phobias that I see as well. Agoraphobia is another thing that I do. So for example, agoraphobia is the fear or discomfort of going too far from your home or from a safe place, and it usually accompanies panic attacks. And so for example, I've helped somebody who was struggling with agoraphobia to greatly widen their ability to travel around the area, as opposed to being confined to their home or to within a block of their home. I also work a lot with panic disorder, where the key feature of that is recurring panic attacks. And so there are very specific things that we can do to not only alleviate panic, but also to decrease the 3 things that I really look for. The 3 metrics that I'm examining to see if we're doing a good job, if I'm doing a good job as your therapist, is the frequency decreasing, is the duration decreasing, and is the intensity of the panic to the same stimulus decreasing. And as I see those 3 metrics decreasing, I can see that my clients are starting to feel better, and the more we do that, the better they feel. So those are the kinds of things that I typically work with. Most of the work that I do is within the framework of cognitive behavioral therapy, or CBT, including exposure and response prevention, or ERP, which is used to treat OCD and OC related disorders, and then also cognitive behavioral therapy for things like phobias, panic disorder, agoraphobia, and a wealth of other anxiety-based disorders. Cognitive behavioral therapy, or CBT, is a therapy that examines the relationship between our behaviors, feelings, and thoughts, and asks us to make the necessary changes within that framework so that we start to feel better. For example, we can't change our feelings, but we can change our behaviors. And while we're not able to control the thoughts that come into our mind, we are able to change them once they're there, or do something different with them. And because all of those things are interconnected, we hope that through changing our thoughts and through changing our behaviors, we will start to feel better. ERP is a form of therapy that asks a person with OCD to expose themselves slowly to their fear, and asks for them to learn some ways to tolerate the distress without doing what are called compulsions, or behaviors that somehow nullify that feeling. An example that a lot of people know about OCD is that people excessively wash their hands. And typically that's due to a fear of contamination. So if we can teach somebody some different things to do and some different ways to behave, once their hands are contaminated or they perceive them to be contaminated, they can see that the anxiety won't last and that they're able to tolerate that experience without doing the compulsion, which is the hand washing. The more we do that and the more we practice that, we can begin to eliminate those compulsive behaviors and start to feel better. As a therapist, one of the most important things beyond our clinical training and the things that we know how to do from a clinical standpoint is our relationship with our clients. One of the most important things that I think therapists can do, and that I hope that I do, is provide a space that's completely safe from judgment, and even at times when it's appropriate, lighthearted. We do a lot of very hard work in the kind of things that I treat, in the kind of disorders that I work with, and so using humor and a personal relationship between myself and the client, I think, is very helpful. There are numerous ways. I think that the most effective is if you know somebody who's worked with a therapist and you have the ability to ask them, then a referral directly from somebody that you trust is really helpful in establishing the relationship quickly. If you don't know somebody or don't know who to ask, where to go, there are tools online to find a good therapist, and there are some questions that you should be asking. Most importantly, what is your experience working with the things that I'm telling you I'm struggling with, that I'm coming into therapy for? And as therapists, we want and we welcome informed clients who really want to know, who is this person who's going to be helping me? Luckily, there are a lot of resources these days online if you're not able to ask somebody who you really trust. When the therapist gets in contact with you and you get to speak with them for the first time, they should welcome your questions and your concerns about starting therapy. I would say that if they don't, maybe it's not a good fit. For example, I get phone calls for people who I can't help. I don't work primarily with substance abuse, and I don't have a specialization in working with eating disorders. And those are two things that really should necessitate a therapist who has a lot of experience working with those disorders. That being said, there are things that I do. So if somebody is calling for anxiety treatment, for obsessive compulsive disorder, for behavioral problems in general, that's something that I typically would be able to help with. There's also different age ranges that people work with. So another question that you could ask is, how many people roughly my age do you work with? Meaning adult, adolescent, children. I work with older children starting at around age 9 or 10 into adolescents, and then adults as well. Mostly in family and individual therapy, depending on the situation. And that's the population that I really enjoy working with. The most effective characteristic, I think, is empathy. From a personality standpoint, I think that there's a lot to be said for clinical training and experience working within a certain disorder, group of disorders, or population. But as far as personality is concerned, I think you want to find somebody who will value the things that you say, hear you exactly as you speak them, and not look at your problems through their own lens. and try to meet you where you are so that they can help you live the kind of life that you want to live. Another trait that I think all good therapists possess is the ability to actively listen to what you have to say and to try to understand you from the context of where you're coming from in your world. One of the things that I really like about my job and about my ability to help people who are dealing with phobias is that sometimes the work is not done here in the office, but rather out there wherever the anxiety seems to be. For example, teaching somebody a lot of different skills here in my office if they have a fear of flying, and then going with them to the airport, going through security with them, getting on a plane with them, traveling there and traveling back all the time, monitoring the anxiety, looking for different pitfalls. And so the people who I treat, the goal is for them to be able to live the kind of lives they want to live. And for some of them, they haven't been on a plane in a very long time. They haven't seen family. They haven't been on vacation. They haven't been able to live their life in the way that they have wanted to. And so that's one of the joys that I get from doing my job, is that I help people find their freedom by leaving the office and going to the place where the problem lies.